We're dedicating every Mindful Monday in February to heart health. Today's focus is on cardiovascular disease. Statistics show one person dies every 33 seconds in the United States from the disease. We're joined this morning by Dr. Mohammed Osman, cardiologist with Mayo Clinic Health System. Good morning, doctor.
Good morning.
Thanks for joining us. So let's just start by kind of explaining what heart diseases are.
Well, you know, Alexandra, heart disease is a very common and a broad term that encompasses different conditions. The most common type is coronary artery disease. You know, that's when cholesterol build up over the years and deposit within the arteries, leading to narrowing of these arteries or blockages.
Okay.
That's the most common types. But other forms of heart disease include basically diseases of the heart muscles, diseases of the heart valves, or the electrical system, which can cause irregular heartbeats every now and then.
Okay.
These are the most common types of heart disease.
And when you're seeing heart disease, people come into your office, are they usually older or is it all age groups? What are you seeing most commonly?
Well, very good question. You know, I would say older age groups get more heart disease. You know, as we age, our heart muscles and arteries tend to accumulate more cholesterol. But certainly we're seeing many young patients also coming with heart disease. Certain genetics, certain disease conditions, or even lifestyle choices, you know, will lead to some disease manifestation among young patients.
Are there any facts about heart disease that surprise a lot of your patients, or anything people should know that they may not?
I think we get a lot of, like, you know, questions. Most of the people know the basics of heart disease,
Right.
but some of the questions that we get about gender differences in the symptoms, you know. We know, for example, in heart attack, you know, the classical symptom is basically chest pain or shortness of breath. But among women, they usually tend to present differently. So women tend to present with either shortness of breath alone, or just feeling tired, fatigue, or sometimes just dizziness. That may be just a sign of a heart attack. Some of the other actually good points and questions that I always, you know, find it intriguing to discuss with my patients is basically the relationship between mental health and heart disease. We know that anxiety, stress, or even sleep deprivation actually has a direct link and indirect links with the heart health.
Okay, so maybe women, if they're experiencing some of those, but not the classic signs, they should definitely call their doctor.
Oh, definitely, yes.
Okay, good to know there. Some uncommon signs of heart disease as well, like in your leg. So tell us about that. That may be something people also don't associate.
Yeah, and that's something I'm passionate about because one of my main interests, you know, I'm a cardiology doctor, but also vascular doctor. So I treat these patients with leg disease. So with time and over the years, cholesterol tend to build up within the arteries, and that can happen in any arteries, you know, arteries to your brain, arteries to the heart, and arteries to the leg.
Okay.
So when these cholesterol deposit build up within the arteries, it can cause narrowing or blockage, and it can impair blood flow and oxygen supply to the muscles. If that affects the arteries supplying the leg, that can manifest as some cramping, you know, upon walking, or even just like chronic wounds in the legs or ulcers that are not healing.
Okay, interesting. Yeah, you definitely wouldn't think of that.
Yeah,
so good to know. Yeah, so any leg pains you should maybe, and then is that women of a certain age, or any woman who's experiencing kind of leg pains? Is it leg numbness too, or?
So it's common among both genders. I would say women and men can get these cholesterol buildup within the arteries supplying the legs, and we see that with elderly patients and among diabetics or smokers.
Okay.
These are the usually common affected, you know, populations. But I would say for any patient who are having just some cramping, you know, in their legs upon walking, which usually goes away when you rest, you know, for a while, you need to talk to your doctor about checking the arteries to the legs.
Okay, very good tips there, doctor. Thank you for sharing some knowledge with us this morning.
Thank you. Thank you for having me.
Yeah, stay with us. We're back after this break.